during this section, we're going to recognize and manage life threats based on our simple assessment findings for a patient with special needs and considerations while we're waiting for the ambulance to arrive. We're going to want to know first what a normal delivery is and what to do if there's vaginal bleeding in the pregnant patient. Also, how are we going to take care of a newborn and how do we resuscitate a newborn? We want to be able to manage these life threats and assessment findings with patients while we're waiting for those emergency responders to arrive and help us. We also need to remember that we need to manage shock of a pregnant patient and if there is excessive vaginal bleeding. Also, we need to know what to do if there is trauma to the pregnant patient and what to do when there is more than one patient who may be delivered or undelivered. We need to know how to recognize and manage the trauma in a pregnant patient, the pediatric patient, and the geriatric patient. We all know that childbirth is a normal and natural part of life, but that changes when we know that we might have to be the one to deliver that baby. Just keep in mind that the part of the process for you is just to help mom and support the infant as it's born. We need to just make sure that the infant is warm and breathing adequately and that mom is doing okay. So while we're on scene, how are we going to know if we're going to be the one delivering this baby? There's two indicators for an impending birth. The frequency of the contractions and if there's crowning. If we do not have those two indicators, then we are calling 911 and we're having an ambulance come to transport this woman to the closest hospital. Because the last thing we want to do is have to deliver the baby if we do not need to. So first, let's get into how a baby is made. The ovaries produce the eggs, and then the egg travels through the fallopian tube to the uterus. The uterus, also known as the womb, holds that fertilized egg as it develops during pregnancy. The developing infant and fetus is now encased in the amniotic sac, which supports the baby while floating in the amniotic fluid. While in the womb with the amniotic sac and the fluid, that creates a cushion for the baby if there's any trauma to mom. So in this diagram, we can see the external opening is called the birth canal, also known as the vagina. In the photo, we see the placenta, which supplies the nutrients and the food to the baby. And attached to that placenta, we see the umbilical cord that goes to the baby's belly button. That baby is wrapped up into the mother's uterus, and then you can see the little yellow pieces surrounding the baby. That is the amniotic fluid. Then we have the bladder, the sacrum, the rectum, and the vagina. So there's 3 stages of labor. The first stage of labor is the pregnant woman's body prepares for the birth of the baby. That's when the initial contractions occur, the water breaks, and a bloody show occurs. Keep in mind that the infant's head does not appear during contractions during this first stage of labor. The second stage of labor is the actual birth of the infant. At this point in time, you're going to see the infant's head emerging through the vaginal opening during contractions. If we do see this, we need to keep in mind that there is absolutely no time for transport and that delivery is immediate. Then the third stage of labor is actually called the afterbirth, which is the delivery of the placenta. We want to keep in mind that we want to keep the placenta with mom and that it may take up to 30 minutes to deliver, and that the reason for having the placenta with mom is to make sure that there are no bits and pieces left behind inside of mom, which can cause shock or any other issues with mom, as that if that is left inside, there could be other issues or conditions created by that. So we want to make sure that that definitely comes with us to the hospital. So if we don't want to wait for the placenta to deliver, we can just wrap mom up, put her on, on the stretcher, wrap her in blankets, and that placenta will deliver on its own. So when we're helping the mother deliver her baby, we have to keep in mind, is this the woman's first pregnancy? These questions that we are going to go through are going to determine whether or not we have actual time to stay on scene or if we are going to bring her to the hospital. So if it's the woman's first pregnancy, it is said that she may have more time to reach the hospital. Ask her, has her water broken or has the bloody show occurred, which is just a term used to describe a leakage of fluids or discharge from the vagina, which is indicative of delivery. If either one of these things has not occurred and it's her first pregnancy, then we know that we actually may have more time to get her to the hospital. Also, we should ask her how many contractions or how frequent the contractions are. Are the contractions less than 2 minutes apart? If they are less than 2 minutes apart, that should be another red flag for us to say, okay, delivery is going to be imminent. If they're longer and further apart, maybe 5 to 10 minutes or every 20 minutes, then we know that we have time to get her to the hospital and that the ambulance should bring her. We should also ask if the woman has an urge to move her bowels. If the woman has the urge to move her bowels and she wants to get up to go to the toilet, we want to recommend against that because usually that indicates that the infant's head is in the birth canal and it is pressed against the rectum. If that is the case, then we want to just make sure we don't see any crowning during contractions. Again, if we see crowning during contractions, that indicates that we are going to have a delivery soon and that we cannot transport her to the closest facility for delivery. We will be delivering on scene. Do we have an ambulance en route? How far is the hospital? Are considerations when determining whether or not we have time to get her to the hospital. And is there any bad weather or natural disaster or anything else that's preventing us from getting to the hospital in a timely manner? So how do we time contractions? Well, we want to time the contraction cycles from the beginning of one contraction to the beginning of the next. So once one contraction ends, let's time in between to see when the next one starts. If contractions are less than 2 to 3 minutes, we know that delivery is close and there is no time for transportation to the hospital for delivery. Keep in mind that we should get ready and prepare for delivery by grabbing some things from your patrol vehicle. What should we be grabbing? We should be grabbing our medical bag. Inside that medical bag, we have an obstetric kit. We want to make sure we have that, have enough gloves, have our glasses, and any other items to help us prepare for delivery. So let's check for crowning. We're going to observe the vaginal opening during a contraction. If you see the head, like we stated previously, during that contraction, we are preparing for delivery. Do not risk transporting the woman to the hospital. The baby is coming. So, are you prepared to assist the mother in delivery? Well, we want to make sure that we keep the mom calm. Delivery, again, is a natural process. We need to be calm to calm mom, and you are only there to help. You obviously are not going to be able to maintain sterile conditions, so we're going to want to be as clean as possible. So use hand sanitizer beforehand. Make sure you have your proper, PPE, protective equipment. Put your gloves on, put your goggles on or your glasses on, and make sure you have your obstetric kit. Ask family members or another officer on scene to get you towels, some clean towels, or some blankets to prepare you for the delivery of the baby. What are we going to want to do with mom? We're going to want to place her on the firm surface or, a couch or the bed, and we're going to want to make sure that the area is padded with the blankets, folded sheets, or towels. We're going to elevate her hips and make sure that they're elevated by pillows or blankets, and then we're going to place her on her back with her knees bent and feet flat on the surface beneath her. This is a normal delivery position. So while preparing for birth, there's going to be both blood and bodily fluids, so make sure that you guys are prepared to keep yourself safe. from any of these fluids getting on you or your gear. Here you can see the obstetric kit includes sterile gloves, the umbilical cord clamp, scissors, gauze, a bulb syringe, and so forth. We already discussed that you're also going to need the sheets, the towels, suction if available, and oxygen. In your medical bags, you do have oxygen, the appropriate masks, the appropriate bag valve masks for adults and children and infants, and any other materials that you will need. So don't forget that there are 2 lives to be considered in the situation. First, the life of the mother, and then once the newborn is delivered, the life of that newborn. We're going to make sure that we do not neglect to perform a patient assessment on the mom as well. Your primary purpose is to assist in the delivery of the infant, although if there are other officers on scene, we can keep one officer with the patient assessment of the mother, and then the other with the assessment of the infant. We want to make sure we're going to be as clean as possible during this entire delivery process. So as we are assisting with the delivery of the infant's head should emerge slowly. We want to make sure we don't want to put stress on the infant or on the mom, so we do not want to pull on the infant as the head is emerging. We want to just make sure we have our hands there to support the head. We want to tell the mom to stop pushing once the head starts to slowly emerge from the vagina. In a normal birth, the infant's head will start to turn by itself the infant will turn to its side by itself after the head emerges. The rest of the body will be delivered spontaneously. Keep in mind that the infant will be wet and slippery, so make sure you have those towels and cloths or anything else you have to use nearby. Once the infant is delivered, we want to make sure that the infant's head and the body is about the same level of the woman's vagina. Why do we think that is? Well, the reason why we want to do that is because the umbilical cord and the placenta is still attached to mom inside the body, and that's where all the blood and the nutrients are, and there is still a pulse in the umbilical cord during delivery. So we want to make sure we don't either elevate or lower the baby too much from a level of where her vagina is to make sure there's no issues with the placenta in the cord. So in this diagram, we can see here that we are seeing crowning at the vaginal opening. The second picture to the right, we have, let's say, your hands holding the infant's head. We're not pulling, we're not tugging, we're not doing anything like that, just holding the infant's head. You can see you have asked the mom to stop pushing during the contractions, and the shoulders are starting to come out. As you can see, the shoulders are now emerging, and the baby has now been delivered. Let's just say in the first photograph, we see that there's the amniotic sac wrapped around the baby's head. And as the head starts to emerge from the vagina, we cannot see a clear airway open for the baby. So we're going to want to make sure that we tear the amniotic sac and push it away from the infant's head and mouth. That ensures that once the baby is delivered, we can get an open and patent airway. Another thing we should be looking for is if the umbilical cord is a wrap around the neck of the infant. We're going to make sure that we attempt to slip the umbilical cord over the infant's head, because as the baby is coming out of the vagina, we know that that umbilical cord is still attached to the placenta, or the afterbirth, as we now know that that's what that is called. So to make sure that the umbilical cord does not get tighter over the infant's neck, we want to remove that umbilical cord over the infant's head to prevent any type of airway compromise. If you cannot disentangle the infant, attempt to reduce the pressure on the cord. So what does that mean? That means if the umbilical cord is wrapped around the neck in this photograph, as you see here with the baby inside the amniotic sac, you want to take your hand and just keep it away from the infant's neck so it does not get tighter and strangulate the child. We also are never going to want to pull on that umbilical cord during the entire delivery process. So let's see. Once the baby is born, what are we going to want to do? We're going to want to first clear the infant's mouth and nose. Does anybody know why we'd want to clear the mouth first and not the nose? Well, if we stimulate the nose first and the mouth is filled with any, fluid from the delivery, blood, anything else like that, that baby is going to suck in all the contents from the mouth. And now it's going to start to go into the trachea, the windpipe, and the lungs. Any bacteria or fluid that now goes into the lungs, we now have a compromised airway, and that can also lead to pneumonia or any other ailments from getting that fluid into the lungs. So let's remember, first we're going to want to suction the mouth and then the nostrils 2 to 3 times until they are clear. I like to add that if the baby is out or down from the vagina in the position outside of the mom, the vaginal opening, want to make sure that their head is slightly lower, not too low, but slightly lower, so we can adequately turn their head a little bit, wipe out the mouth, and then suction the nose so any fluids can drain out. So if the bulb syringe in your obstetric kit is not available, or you misplace it or something like that, wipe out the mouth and nose with a gauze pad, which is also in your, obstetric kit. Then we're going to want to place the infant on the mother's abdomen to keep the infant from losing warmth. That's to be said that the infant is now breathing adequately on their own. So here we have a diagram of using that bulb syringe in your kit, suctioning the mouth and then the nose. Let's say the infant is not breathing. After you suction the mouth and the nose, what are we going to want to do? We're going to want to try to stimulate the infant the best way we can. So it is said to flick the soles of the infant's feet, stimulate breathing. You can pinch the skin. Or use a towel to dry the body and wrap the baby into a blanket to keep him or her warm. But we want to make sure we stimulate the infant enough to get them to start their breathing. We're going to want to place the infant on the side with the head slightly lower than the trunk. When the umbilical cord stops pulsating, we can clamp it with an umbilical cord clamp or tie it with gauze. We also want to note the time of delivery and keep in mind that if there are multiple births, we are going to do this all over again and prepare for a second delivery. So this third stage of labor is the delivery of the placenta, and we want to make sure that that placenta again goes with mom and baby to the hospital. The doctors need to check the placenta to make sure that there are no tears or any of the placenta left inside of mom, because that can cause a lot of medical problems, sepsis and or shock to mom. So the placenta will deliver maybe about 30 minutes after delivery. Make sure if the placenta is delivered on scene, you want to take either a blanket, wrap it up, a bag, that's in your obstetric kit for medical waste, and bring that with mom. We never want to pull on that umbilical cord during the entire pregnancy and even after delivery. Or you can leave the umbilical cord uncut and attached to the placenta and the infant until EMS arrives if you are not comfortable with cutting it yourself. And we already touched base on the delivery of the placenta and what to do with it. Let's say that you decided not to cut the umbilical cord after the baby was delivered and the pulsating of the cord has stopped. You want to keep that placenta at the same level as the infant, as you don't want the blood to either decrease to the baby or reflow back into the placenta. So after the delivery of the placenta, the mother's bleeding will usually stop. after the placenta is delivered. If it does not, we're going to want to massage the uterus. How would we do that? So we would take one of our hands and just place it above the mother's pubic bone, and you're going to use your other hand to press down into the abdomen using a circular motion to massage the uterus until it becomes firm. This should take about 3 to 5 minutes. Now, if you're not comfortable with doing this, you can either ask a family member or the mother herself to do this by using her hand and placing it above the pubic bone and massaging in a circular motion and massaging it until the uterus has become firm, or up to 3 to 5 minutes. We want to make sure that we're constantly assessing mom and baby. Keep checking on the uterus for firmness every 3 to 5 minutes, and just make sure that the mom is not having any excessive bleeding. So if the infant does not breathe on its own within the first minute after birth, we're going to want to assist with ventilations with a bag valve mask or blow-by method, or we're going to unfortunately have to start CPR on the newborn. There are some other complications with pregnancy and childbirth. So when we go to call, routine calls for service, let's just say, we end up going to a call and the mom has severe abdominal pain, and the mom starts to present with signs and symptoms of shock. That could be an ectopic pregnancy. This is when a fertilized egg becomes implanted in the fallopian tube rather than in the uterus. And as the embryo starts to grow, it expands and causes the fallopian tube to rupture. That rupture causes acute abdominal pain, the internal bleeding, and shock. We're going to want to treat for shock and get her to the hospital as soon as possible. Another complication of pregnancy and childbirth is miscarriage and unknown vaginal bleeding. A miscarriage is also known as a spontaneous abortion, which is the delivery of an incomplete or underdeveloped fetus. If a miscarriage occurs, we're going to want to save the fetus and all the tissues that pass from the vagina, control the woman's bleeding, and treat for shock, and arrange for prompt transport. It is said that vaginal bleeding is often the first sign of a miscarriage. However, we know that there are other medical conditions that can cause vaginal bleeding, and it does not always mean that there is a miscarriage. But if there is vaginal bleeding, you're going to want to make sure that this is a true medical emergency in the pregnant woman, and that she needs prompt transport to the hospital to give supportive care, get a patient history, so you can quickly give a report off to EMS or whoever shows up. Keep in mind that during a delivery, you may encounter a premature birth. All the signs and symptoms of an imminent delivery will be there, with the head crowning, contractions less than 2 to 3 minutes apart, the bloody show occurring, and so forth. But with a premature birth, your newborn will weigh less than 5 pounds, and they are delivered before 36 weeks. This infant is going to be a lot smaller, they're going to be a lot thinner, and they're usually redder in skin than the full-term newborn. If you were to deliver one of them, we're going to want to make sure we keep the premature infant especially warm, because they lose heat a lot more rapidly as they have a lot smaller bodies and thinner skin. We're going to want to arrange for prompt transport as well. We talked about this already. Unbroken bag of waters, we're going to want to make sure we break it if we are doing a in-field delivery, as we don't want it to compromise the infant's airway by any means. We just want to make sure we're not too rough when we're doing it. Be careful not to injure the newborn in the process. And then suction the newborn's mouth and nose to help them breathe when appropriate. Another complication of pregnancy and childbirth is if during a visual of looking at the vagina to see if there is any crowning, we may see that there is a prolapse of the umbilical cord. So the cord may be compressed between the infant and the woman's pelvis during contractions. So we're going to make sure that we raise the pregnant woman's hips and then cover the cord with a moist dressing. We never want to push it back into the vagina. We need to make sure that we arrange for prompt transport while providing oxygen and other care. So another complication is a breech birth, where the infant's buttocks come down to the birth canal first rather than the head. Now, if we see a butt or a leg coming out of the woman's vagina, we know that prompt delivery is going to happen, and that usually the head will follow on its own. We're going to want to do the same thing, support the infant's butt or legs, and make sure we don't pull on the infant. Keep in mind the infant is going to be slippery, and we want to just make sure once the head is delivered or coming out of the birth canal, we ensure that they have an open and patent airway. So let's say during that breech birth, the head does not deliver within 3 minutes. We're going to want to arrange for prompt transport. At this time, this is the only time you would ever stick your hand inside a pregnant woman's vagina, is when the head has not delivered within 3 minutes. We want to make sure the infant does not suffocate. So what you're going to do is you're going to take a gloved hand, place it into the vagina, and use your fingers to keep the infant's airway open. So if you take your hand, let's say you take your right hand and you make a V with your middle finger and pointer finger, and you'll make a V, and you're going to want to push up on the baby's chin and nose and mouth area and make a space in between the woman's vaginal wall and baby's face to keep there a space there to allow the airflow to happen. Make sure that the baby is breathing on his or her own. In very rare cases, the arm of the leg is the first part of the limb of the infant to appear in the birth canal. Keep in mind that a limb presentation cannot be handled in the field, and that this is a true medical emergency, and that prompt transport is the only way to safely deliver this infant. Unfortunately, sometimes an infant dies in the uterus before labor. Those are the calls for service that we get, where either mom can't feel the baby move anymore, or she wakes up and she notices that there's some crowning, or she feels something and she doesn't know why she's delivering. At this point in time, unfortunately, the fetus will generally have an unpleasant odor and will not exhibit any signs of life. You're going to want to carefully wrap the stillborn infant in a blanket and turn your attention to the mother and provide physical and supportive psychological support to her, as this is something that mom is now going to have to go through. We're going to make sure we bring both the infant and mom to the hospital for supportive care, and make sure that we take the placenta, if delivered, as well to the hospital. So let's say there's multiple births. There is going to be another set of labor contractions that will begin shortly after the delivery of that first infant. So you're going to want to get ready to repeat the procedure you did with delivering the first infant. Keep in mind that there might be excessive bleeding. Treat her for shock, elevate her legs, massage the uterus like we talked about previously, and arrange for prompt transport. To stop some excessive bleeding after delivery, we can encourage the newborn to nurse at the mother's breast. Again, massage the uterus and arrange prompt transport. So some special considerations for pregnant women with car crashes are that any woman involved in a car crash should be examined by a physician, because the force involved in even a minor crash may be great enough to injure the woman or the unborn child. So we want to make sure that they get to the hospital and advocate for them. Always treat for shock if you have signs and symptoms of that, and make sure that the woman is laying on her left side rather than on her back, as that decreases pressure on the aorta. In rare cases, a crash can be severe enough to kill the pregnant woman, but not the fetus. We want to keep in mind that we are going to continue to provide CPR to the woman while transporting her to the closest medical facility to deliver that infant. So in summary, the key indicators in estimating how soon a delivery will occur are crowning and the time between contractions. Stage 1 of labor is characterized by the following conditions. Initial contractions occur, the bag of water breaks, the bloody show occurs, but the infant's head does not appear. Stage 2 of labor indicates the actual birth of the infant. That's where you will see the infant's head crowning during contractions, in which you must prepare for delivery. And then stage 3 of labor involves the delivery of the placenta. You are going to assist in stabilizing the condition of the mother, the newborn, and the delivery of the placenta. You're going to want to make sure all those things go with you to the hospital. Want to make sure that we exercise standard precautions, making sure that we keep ourselves safe during a delivery, and make sure that we are treating both mother and infant, and to provide the appropriate care for both mom and infant if there is any breathing difficulty or cardiac arrest.
I knew when I pulled up this is going to be a big deal.
With the protests in Ferguson and a couple of officer-involved shootings locally, it feels really good to tell you about this next story. An Elk Grove police officer, not even on duty, saved a life.
But as News 10's Nick Monticelli tells us, the way that it happened and how it happened is far from normal.
When you're driving and see one of these, you usually become the best driver in the world. Most of us aren't looking for attention.
I was driving into work, into the office, and I was flagged down by a couple in a car, and right off the bat I knew something different was going on.
Something different. So much so that Elk Grove police officer Dan Templeton turned his dash camera on just in case. He had no idea what was waiting for him inside that SUV.
I obviously had to change uniform because I was covered in stuff. The highlight of my career. It's an amazing day.
Hello.
And that amazing highlight of his career moment happened right here. And it's all the guys at Les Schwab can talk about.
Well, we've been getting suggestions that it should be less for Schwab.
I think you honked.
Yeah, I did honk.
Who got my attention, and I saw you from the back seats leaning up forward. I'm like,
Yeah.
what's this lady doing with her seatbelt on?
I'm gonna give her a ticket.
Give me a ticket.
That's Mom, Vanessa Rios, and Josiah, not less, all 8 pounds, 14 ounces of him, delivered by a cop in a tire store parking lot. The rest of the dash cam video is a little too, shall we say, personal. We haven't even seen it.
He helped me out of the car, pulled me out onto the blanket, laid me down.
The Les Schwab employee, though, came and he saw everything.
It probably traumatized him for life.
Was there any part of you that was laying on the concrete thinking, I don't know about this. This cop is about to deliver my baby and he's not a doctor?
No.
You were?
You? No, I had all my faith in him.
Yeah. He has it under control.
And he did, but it wasn't simple. Josiah's birth was so far along, he was already crowning and not breathing.
The head's already out, and it was completely blue. It was the third push that I got a good hold of the base of the head, and it popped right out. And it took a second or two, but then it started breathing and crying, and I knew things would be okay.
Don't know how I would have done it without you there.
You get choked up, especially because I have kids and I know the experience. And first thing I want to do is go tell my wife, who works here as well, and tell her what happened, and we both teared up a little bit.
So Josiah's actual due date was August 22nd, and Mom and Dad have both decided they don't need to have a third baby because the third will probably just fall out.
Well, I mean, that is quite the way to come into the world.
Yeah.
But, you know, I don't know. Having been there, Barnum and Bailey could be going on at the end of the table and you don't care. You're in the moment. So.
You know what was really amazing, too, was the timing of it. I mean, they could have been, a quarter mile down the road, 30 seconds behind, and that officer wouldn't have been there. It just happened to be that he was right there, and they said, oh, we need help.
Well, and then there's a little bit of a problem with the baby, too, with the cord. And
And the breathing.
But Mom is in great spirits and having a laugh with it, too. So.
Well, who's having a laugh at the rest of the officers? I think there's some diapers and bottles on off Templeton's desk right now.
Excellent. Well done, officer.
Officer Dan, good stuff.